My name is Kelli Roberts, and I manage the safety program with the Georgia Department of Transportation, alongside Ron, the supervisor of the program. Today, we will be discussing our systemic safety countermeasures as well as our collaborative approaches, which have been allowing us to expedite the delivery of critical safety infrastructure. Starting with 3 takeaways. Number 1, engaging partners across the state to optimize project delivery. With the rising fatal and serious injury crashes throughout the state, it's simply not feasible for one program alone to tackle this enormous issue. Therefore, we are engaging all of our partners across the state to help optimize delivery and project timelines. Number 2, shifting away from a complaint-driven focus to a more systemic approach. This allows us to address safety issues across multiple roadways rather than investing a high dollar value in one location. And 3, proactively assessing safety. This is also in line with the systemic approach. How can we target fatal and serious injury crashes? How can we mitigate those before they even happen, taking into account risk assessment instead of solely relying on historical crash data? So let's talk about these crashes. What are we seeing here in the state of Georgia? On the slide, you can see fatal crashes from 2008 to 2022, and we've seen a notable increase in our fatal crashes over the last decade. You can also see that we were significantly impacted by the COVID-19 pandemic. People were stressed out due to everything going on, and that really translated to their behaviors behind the wheel. We saw increases in speeding and aggressive driving, increases in impaired driving as well, and decreases in seatbelt usage, all which resulted in an increase in fatalities across the state. And Georgia is not alone in this issue as well. This is a nationwide issue in terms of increasing fatalities, as well as a fewer and fewer amount of states being able to either meet or make significant progress towards their safety performance targets. And this just shows the emphasis that safety has nationwide and how critical it is to work with our partners and deliver this type of life-saving infrastructure as quickly as possible. And that fatal crash trend is even exacerbated when we talk about our most vulnerable road users. When we look at pedestrian-specific fatalities from 2008 to 2022, we can see a steady increase. Not only has the number of pedestrian fatalities been increasing, but the proportion that pedestrian fatalities count for of our total fatalities has also been increasing. And again, I do want to note that Georgia is not alone in this issue. Not only is this a nationwide issue, but particularly the Southeast has been impacted when it comes to the rising trends in our pedestrian, bicycle, and our most vulnerable road user crashes. And that's why we're working with our external partners that are focused on those vulnerable road users, such as our regional commissions and transit agencies, to see how we can expedite delivery of infrastructure specifically for those road users.
One of the ways we're looking to combat these roadway fatality trends is through a partnership with a network of organizations. Georgia has various task teams for each of the emphasis areas in our strategic highway safety plan. These task teams are formed in cooperation with the Governor's Office of Highway Safety. These task teams leverage the safe system approach and allow for collaboration amongst various stakeholders, including engineers, planners, advocacy groups, trail organizations, public health departments, local governments, federal government organizations, and much more. One of our key partnerships is with the regional commissions to support bicycle and pedestrian planning. This is comprised of educational initiatives, creating long-range plans, and completing safety screenings, which are data-driven recommendations to the safety program for projects. We also collaborate with a variety of different organizations to deliver educational initiatives to students and law enforcement. These initiatives include our Safe Routes to School program, where we organize hundreds of events such as walking school buses and bicycle rodeos. We also collaborate with Teens in the Driver's Seat, a peer-to-peer safety program for young drivers. We've updated our crash reporting instructions to make reporting to law enforcement easier and more accurate. Furthermore, we've collaborated with the Let's E43 program to host safe driving summits, which are held to educate young drivers, the potential dangers of driving distracted and under the influence. We also have our Keep Georgia Safe initiative, which created a variety of different educational material that can be taught to students K through 12. And we also have a partnership with Georgia Bikes. With one of their greatest partnerships is the Bike Walk Live Summit, which spreads awareness and technical information on bike and pedestrian safety. Currently, GDOT's Office of Planning the Safety Program and Georgia Bikes are collaborating on Georgia's Rural Active Transportation Plan. This includes an evaluation of our existing bike and pedestrian policy and guidelines, as well as an evaluation of our state bicycle network, and will provide guidance on how to apply funding for bicycle and pedestrian facilities statewide. This active transportation plan is intended to focus on projects outside of NPOs.
Since 2019, GDOT has heavily invested into our crash data application known as AASHTO Air Safety. We have an unlimited amount of seats and offer our governmental agency partners free seats so that they may perform their own safety analysis targeted specifically to their agency. One example you can see here on this slide is with our transit systems. We have identified all of our transit systems across the state, and now those agencies can go in and identify the stops or the locations on their transit systems that have the highest historical crashes so that they may prioritize some improvements on their system. Something else that we have included is known as the Social Vulnerability Index, and that was created by the CDC to assess how vulnerable certain communities are to responding to certain natural disasters or emergencies. And so one subset of that Social Vulnerability Index is known as transportation. So not only can we look at the historical crashes associated with, a certain transit system, but we can also see those that are more vulnerable from a transportation perspective, those who are going to be more willing or more apt to use that transit system and prioritizing those improvements. So you can see how we're helping our outside agencies as well as trying to take in that more proactive approach instead of purely relying on that historical crash data. So here you can see how this kind of all comes together into how we can actually identify a project. So as part of this really strong crash data platform, we have something called a sliding window analysis where we can actually identify the highest, half mile, mile, whatever predetermined segment that we choose based on other filters. So we can actually bring all of these together. GDOT also has something known as the Safety Equipment Purchase Program. This is where we can use our HSIP dollars to buy safety justified equipment that is then delivered to the district and picked up by a local agency and installed using their maintenance courses. This allows for the quicker delivery of safety infrastructure. And if we put this all together, now hopefully you can see how a local agency can freely access our crash data platform, identify the location that has either the highest crash history or risk for future crashes, and then also apply for equipment, get it delivered, and install it. So really providing a lot of opportunity for our locals as well as other agency partners. This highly expedites the delivery of safety infrastructure as well. GDOT is also coordinating with our internal stakeholders, such as our state maintenance program. On the slide here, you can see some low-hanging fruit that we incorporated into their project that didn't impact cost, but it did increase the safety benefit that we saw in the project. So a very small example of that is some wayfinding signs with some interstate shields for this maintenance project. And aside from the low-hanging fruit, we can actually have a lot more transformative projects partnered with our resurfacings as well. This one on the slide shows a lane reconfiguration that was able to be accomplished through a resurfacing. The costs were a little bit more significant increase. I think it was around the $500,000 mark. But when you compare that to the cost that it would have taken to deliver through the HSIP program, it would have been much more expensive and much more timely. So very excited to be able to deliver this type of transformative project that provides bicycle accommodations on a critical corridor in downtown Atlanta.
The safety program is pushing an emphasis on addressing safety at a roadway network across a large area proactively rather than reacting based on complaints. One of our systemic projects is curb safety improvements. Through research done at Georgia Tech, we have automatically identified all the required and optional signage from the MUTCD on our sharp curves throughout our state route system. We delivered approximately 10,000 signs and $2.5 million worth of signage in the GDOT District 1 thus far. We're not stopping at signage though. On our higher risk curves, we're installing more advanced countermeasures such as higher friction and flashing signage. Another systemic initiative we have is our systemic transit crossing analysis. The bottom line is that people need to cross the road to get to a bus stop, and that there is a statistically significant correlation between ped crashes and bus stops on our system. Therefore, we're either installing mid-block bus stop crossings or moving bus stops towards signalized intersections. Thus far, we have identified 150 locations on the MARTA bus stop system with an average benefit cost ratio of approximately 13. We're currently identifying hundreds of more similar locations across the state. Another systemic initiative we have is replacing overhead beacons at minor stop-controlled intersections. Our crash data has shown that at minor control intersections with overhead beacons, drivers on the minor street assume that drivers on the major street also have a stop control. Therefore, the overhead beacons are likely causing more harm than good. Therefore, we are systemically removing them and, based on the roadway environment, implementing a proven safety countermeasure at that intersection. Another systemic initiative we have is our Everyday Counts Nighttime Visibility Improvement Program that's in partnership with FHWA. One of the pieces of this is adding lighting to existing mid-block crossings, and another is adding lighting to existing utility poles. This is done throughout partnerships with Georgia Power. Furthermore, another systemic initiative we have is upgrading existing all-way stop control intersections with low-cost countermeasures such as reflective striping, rumble strips, and stop-ahead markings. Remember those three takeaways that we mentioned at the beginning of this presentation? The first being, should we engage partners at the statewide system to optimize the delivery of our projects? We're shifting from a complaint-driven approach to a more systemic approach, and with that systemic approach, we're addressing safety more proactively. So thank you guys very much, and we'd love to take any questions.